Hello, my name is Melissa, and I'm going to be assessing your thorax and lungs today. I just was going to ask you a few questions to start off with. Have you had any cough, shortness of breath, chest pain with breathing? No?
No.
Okay. Any history of smoking or exposure to environmental toxins?
No.
No. Are you exposed to chemicals where you work?
No.
No? Okay, good. Well, I'm going to start by inspecting your chest, okay? So I'm going to have you lower your gown. Okay. And I'm going to be looking at the symmetry of your chest. Okay, that's good and symmetrical. And then I'm looking at the costal angle of your chest. And the angle of your ribs. Can you raise your chest up for me a little bit? Good. Your intercostal spaces. And can you take a breath in and out for me? Okay, looking at the muscles of your respiratory tract there. Now I'm going to be comparing your anterior posterior to your transverse back there. Okay, good. It's about half the size of your transverse back here area, so that is good. That's normal. You can put your gown up again, yeah. So now I'm going to be inspecting your skin. And you don't have any cyanosis, any pallor, anything like that, or any superficial veins. And your ribs are not overly prominent, so that's good. Now I'm just going to have you kind of raise up a little bit. I'm going to be looking at your thoracic landmarks. Okay. Yeah. Okay. Now I'm going to be checking your pulse. Okay, I got your pulse for 15 seconds. I multiplied it by 4, and I got 72. And then for your respirations, I got 20, and that is normal, so that's good. Now I'm going to be just observing you breathing. Okay. Yeah, I don't see any nasal flaring, so that's good. And okay. No stridor while you're breathing or wheezing, anything like that. Your chest movements are easy and even. Good. No bulges or accessory muscle use. Now I'm going to shine this gooseneck lamp on your chest and observe your breathing pattern as well. Shine it on this side too. Okay, everything looks good. Okay, now I'm going to be I'm going to be checking for clubbing, so I'm going to have you take your index fingers and take your fingers like this here. Put your gown on, there you go. Okay, and you've got the space in between the fingers, that's good. So that indicates that you don't have clubbing. Now I'm going to be warming my hands up, and I'm going to be palpating the muscles and bones of your thorax. So I'm going to have you lower your gown again. You're going to feel me touching. I'm going to go to the back and palpate as well. Oh, you're just going to rotate right there. Good. Okay. Okay. I didn't feel any masses or bulging or anything like that, so that's good. So now I'm going to be checking for thoracic expansion. I'm going to be putting my hands right about the 10th intercostal space, and I want you to take some breaths for me. Okay? One more. Good. Now I'm going to have you, my thumbs stayed symmetrical in my hands. So now I'm going to be checking right at the xiphoid process in your anterior thorax. Okay, my hands and thumbs stayed symmetrical there. So that's good. And now I'm going to be assessing for tactile fremitus. So you're going to be feeling me palpate your chest while you say 99, okay? Can you turn around to the back and we'll start there? Can you say 99 for me? Start now.
99.
Okay.
99. 99. 99. 99. 99.
Okay. So now I'm going to have you come to the front and turn around to the front and we'll do the same thing.
99. 99. 99. 99. 99.
Okay. All right, good. So that all felt fine. So now we're going to be palpating your trachea. So you're going to feel my thumbs like in your substernal notch here. Okay. Can you load your neck up just a little bit? Good. That's aligned. Symmetrical there. So now I'm going to be percussing your thorax. And I'm going to start in the back, if you want to turn around. And what I want you to do is I want you to lean forward with your neck, cross your arms, and lean forward with your head there. Okay? Okay, so now I'm going to have you turn to the side there so we can percuss your side. I'll turn the other side first, yeah. Okay. Okay. All right, now we're going to have you turn to the front. Now I'm going to percuss your anterior chest here. Okay. more time over here. And right here. Good. Everything sounded good there. So, the next thing that I'm going to be doing is having you turn around with your back facing me, and I'm going to be percussing your back again along down your back. And this is going to be checking for your diaphragmatic exertion on your posterior thorax, okay? So you're going to feel me percussing back here. And what I want you to do is when I do this, I want you to take a breath and hold it. Are you ready? Okay. Ready on this side? Okay. I think it was right about there. I heard some dullness. Okay. And then you're gonna take, are you breathing normally now?
Yes.
Okay. Now I want you to take a breath and hold it again whenever you're ready. Right here. All right. Now I'm going to be doing the same thing to the other side, okay? And I want you to take a breath and hold it. Okay. What about here? Now breathe normally again for just a minute. Whenever you're ready, I'll have you take a deep breath and hold it again.
Okay.
Okay. Okay, right here. Okay. So now we're going to measure the areas. Okay, that one's 3 centimeters, and this one is 3.5 centimeters. Okay. So we finished that, and now I'm going to be auscultating in the same pattern that I did when I percussed. And I'm going to start with your back. So what I want you to do is I want you to cross your arms again like you did and put your head down. And I want you to breathe in a couple times through your mouth. Good breaths. In your mouth and out your mouth, yeah. Okay. Then just relax your breathing. Breathe normally. Okay. Okay. Now I want you to turn around on your side. I'm going to listen to your sides, okay? Okay. And I'm gonna auscultate in the same places that I percussed, okay? Keep your breathing. I'm gonna go right over here to the other side. Okay. Okay. Listen to my spots here. Okay. Okay. Now I'm going to be auscultating your anterior thorax. Okay. Over here. Right down here. Okay. Okay. Right over here. Okay. Well, that all sounded good. I heard the bronchovascular sounds over your bronchi and just the vascular sounds over your lung fields. So if you develop any problems, you come back and see us, okay?